My name is Rhonda. I met Linda, like she said, 2 months ago, and she asked me to present and talk, and I said, sure. The closer it got, I thought, why did I say that? I became very nervous. I'm used to talking to my patients one-on-one and not a room full of people. But I had a good friend who talked me through it, who talks all the time. And she said, just get up there and do what you know what to do. So first of all, I want to speak to you about why I named my practice Renewed. When I was praying about this, I asked God, I want you to give me a name that will stand out. That you can't hear me?
I said, I can hear you.
I asked God to give me a name that would stand out that He wanted me to do. And I prayed about it, and He said, Renewed. And I said, Renewed? And He says, yeah, because you have to renew your body, your soul, your mind, and your spirit to be in balance. So I said, great. I called my attorney. I said, see if this name is available. And I said, if it's available, I know it's of God. And it was. So that's how Renewed Healthcare Services came about. And my passion, I do all kinds of sorts of things, but my passion is bioidentical hormones, because I think it's very important that we as women know what our body needs to maintain and not have diseases. I believe in prevention. So my first slide is balance your hormones, balance your life. As we age, we lose our hormones, and it's the perimenopausal phase. That starts around age 35, sometimes 30-year-olds lose them. When you lose those, there's all kinds of diseases that come about. Osteoporosis, cardiovascular disease, breast cancer, all kinds of sort of things. So that's why it's so important to replace those hormones. What are bioidentical hormones? Bioidentical hormones are hormones that we have that they're made from the compound pharmacy out of soy, out of yams, that are converted to us, so they're exactly like our hormones are. If we take these, they don't have as many side effects as all the other ones do. The synthetic. Once you've gone through menopause for a year, then you go into, once you're going through the peripausal mental phase for a year, then you start to go through menopause. And this is when you'll need these hormones. Sorry about that. Why bioidentical hormones? Bioidentical hormones are better for you than synthetic. Synthetic is made out of horse urine. With that horse urine, it's all kind of toxic effects, and that's why people get sick and have to come off the patches and have to come off the gels and different things that your doctor gives you, because they're not made for you. The compound pharmacy makes it for you identical. I can't take yours, you can't take mine, but when you go to the doctor and they write your prescription, it's synthetic. Anybody can take that. There was a study done, Women's Health Initiative, and this was done in 1991. And what they did is they took 161,000 patients that were in menopause. And what they did with these patients is they put them on Premarin and all these different kind of synthetic hormones. And it was a 15-year study. With that 15-year study, so many of the women developed cancer, breast cancer, ovarian cancer, osteoporosis. They got very sick, so they ended it. After that, the women became aggressive and said no more, and that's how they really started taking the bioidentical hormones after that. One of the important type of hormones is estrogen, and I have a lot more on my card, but as you can look, when you start to have symptoms that are hot flashes, night sweats, sleep disturbances, murky thinking, you can't understand what's going on or why you're thinking like this. You have fatigue, you have cravings for sweets and carbohydrates, you have mood swings, insomnia, you have headaches, low libido, stiffness, joint pain, anxiety, heart palpitations, adult acne, hair thinning. And one of the things I did, the reason I got on it back when I was 40, I'm not that much older, but at 40, I had a whole lot of acne. And I couldn't understand where this acne was coming from. So I started thinking, I started going to my dermatologist, and they were giving me all these antibiotics, and then I went and ordered Proactive, and it just tore my face up. So I said, you know, it has to be hormones. So, of course, being a doctor, I wrote myself a prescription for birth control, which is a synthetic, right? cleared my face up, but then I developed a cyst in my breast. And I thought, that's it. I'm not doing this anymore. I hope I don't have breast cancer, God, you know. And got off of that, and then that's when I got on the bioidentical hormones. After that, my face cleared up. My hair started growing back. My hair was just thin. You could see through it. It was like something's going on here. So I got on the bioidentical hormones, and it really helped my face clear up and my hair thicken back up. So those are some really big side effects of that. With estrogen excess, you'll see that in younger girls. And that's when you have missed periods sometimes, or you'll have more mood swings, you'll have headaches, weight gain, because in the birth control pills, there's a lot of excess estrogen in it. You'll have dry skin, tender breasts, night sweats, PMS, fatigue, miscarriages, weight gain, and PCOS, which is polycystic ovarian disease. And what that is when the girls don't have a period for 6 months or sometimes a year. And that's because this hormone, the estrogen, is so much of it that their period won't come on. So when they do come on, then they bleed for months, and they're like, what's going on? And so the birth control evens that out, but if you go to the bioidentical hormone, it'll do the same thing without the side effects. The next one is progesterone. This starts to decrease around 35. I have a 29-year-old patient that came to me. Have you guys ever heard of the Happy Hormone Cottage?
Yeah.
Okay, I work with them, they send me their patients, and I write the prescriptions.